Today in our vlog we have with us Dr. Amir Hamza, and he's an allergy specialist and a pediatrician as well in Pantai Hospital. Not only this, but he is the president of Malaysian Society of Allergy and Immunology. He is also a vice president of Asian Pacific Association of Allergy, Asthma and Clinical Immunology. He is also an American fellow of American College of Allergy, Asthma and Immunology, and also an editorial member of many journals. So sir, you are so busy, but we are really thankful that you are giving us your precious time, and it will be very humble of you that you are going to tell us about drug allergies, which most people don't know. I didn't know that before. So I would like to know, first of all, can you just brief about what is anaphylaxis? What is that condition basically? Can you please tell?
So, Waalaikumsalam warahmatullahi wabarakatuh. So, anaphylaxis is essentially a severe, life-threatening allergic reaction. So, it can be considered something that's going to be happening suddenly. It's progressive. So, once you have anaphylaxis, you know that you must attend yourself and get immediate medical treatment.
Okay.
So, that's the definition of anaphylaxis itself might be variable, but since about 12 years ago, when the National Institute of Infectious Diseases and Allergy in US and the Food Allergy and Anaphylaxis Network, they came together and met to come to a definition. So the simplest definition is as what I've stated. It's a severe life-threatening allergic reaction. But what does that mean when it's an allergic reaction? It means that two systems are going to be involved.
Okay.
So as you know, and in allergy, so you can have involvement of the respiratory system, the skin, the gastrointestinal system, and also the circulation, your cardiovascular system.
Okay.
Those are the main ones. So when you have any two are involved, then you say it's anaphylaxis.
Okay, so like in my condition, I had both of them. So
Yes.
it was kind of severe then.
That's right. I mean, circulation means like you can go into shock,
Yeah.
right? And sometimes that can be very difficult to reverse. Yeah, and that's where, and I'll say it now first,
Yeah.
the treatment of choice for anaphylaxis, certainly when you're going through an anaphylactic shock, is your adrenaline.
That EPIPEN.
Yes.
That is.
Yes.
Okay. So there are many kinds of allergies, that environmental and food allergies. Most people know about that. But drug allergies, would you like to brief about that? What are basically drug allergies?
Yeah. So when we talk about anaphylaxis, so we find out that there will be causes for that. And as you mentioned, yes, the food will be the common ones. And in fact, more than 80% of anaphylaxis in children will be due to food allergy.
Okay.
Right? Maybe in adults it will be a bit different, and we talk about the drug allergy. So when we talk about drug allergy, when we use the word allergy with drugs, it sometimes is misconstrued as not purely an immune-mediated mechanism, because sometimes it doesn't need to have to go through that pathway.
Okay.
Right? So sometimes in many parts of the world, they just call it drug hypersensitivity.
Okay.
And if the immune system is involved, then we say it is drug allergy.
Okay.
So by that definition, drug allergy means that it will take within 2 hours, a period of 2 hours after a drug, and then you get the allergic symptoms that we have already discussed before.
Mostly people usually take it lightly in other parts of the world. So they take it lightly, they just say you are having an allergic reaction to something. Because like I knew that I am having a reaction to drug, but people were telling me you have food intolerance or wheat intolerance. Well, people usually misguide you because they don't know about it much. So through this video, we will be like to tell that if someone know that you had some kind of drug and you are having an allergic reaction, what are the precautions that a person can take at that moment, and treatment, there is no treatment for that. Of of course.
Yes,
But
it's only the avoidance of the
Yeah.
drugs once you know. But
Yeah.
that's the point. And I'm glad you said that, you see, because making that sort of assumption is very dangerous.
Yes.
Yeah. So you got to be sure
Yeah.
that there's no allergy, because that's life threatening.
Yes.
Right? So intolerance is not going to be life threatening.
Yeah.
Yeah, let's say it's food intolerance, or most of the time you end up just getting a lot of bad abdominal cramp, bloatings, and a
Yes.
bit of diarrhea. That's about it. But when you go into a shock, your blood pressure goes down, your loss of consciousness. So at that point of time, obviously the recognition of the diagnosis must be well established. And if somebody has said that it's anaphylaxis, it should be referred to an allergist
Okay.
right after the acute treatment of the anaphylaxis has been done. So it needs to be referred to an allergist to assess even better how to confirm the
Yes.
diagnosis of the drug allergy.
Like for the assessment and the test, like there are 2 to 3 types of tests we can have for drugs. But can you please tell about the types of drugs test, and what is the most reliable one that a person can have?
Sure. If you talk about drug allergy, just coming back to that, the types are usually most commonly antibiotics. Then you can have your pain medication, your non-steroidal anti-inflammatory drugs. You can have also sometimes the anticonvulsants, so people who got seizures,
Yeah.
and of late people who undergo, say, chemotherapy. So the drug,
Yeah.
they're beginning to develop more of those situations where you can get allergy. So if we talk about the diagnosis, so we talk about the blood test, right, to look for specific IgE, and we talk about the skin test, that is both skin prick test, plus minus intradermal test,
Okay.
and then the gold standard still has to be the drug challenge test,
Okay. The oral one.
the oral one. But sometimes if we have to do intravenous, it can have to be done, so it will be done so as well. But most of the time, I just do the oral,
Oral one is
or
the
oral
most
ones, yeah. Or
reliable.
sometimes a local anesthetic, so I might do a subcutaneous,
Okay.
yeah. But so 3 categories: blood, skin test, challenge test. So those are the ways to diagnose
And the
drug
oral one
allergy.
is the most reliable one.
The most reliable is still going to be the challenge test,
Yeah.
whichever method is
Okay.
according to the drug being used.
Okay.
Yeah, but in terms of, say, blood test, unfortunately there are not many choices that we can do.
Yeah.
There's probably
Penicillin.
only penicillin.
Yeah.
And even the skin test, probably the most reliable, that is more diagnostic, again is penicillin as well.
Yeah.
The rest, you might be negative, but it could still be a
Yeah.
false negative, so you still end up with a oral challenge test. Yeah.
And do you have a sample of EPIPEN that you said? Can you show that? So people can know that in case of emergency, this is the only thing. In case of anaphylaxis, a
Yes,
person can use.
yeah. So this is an EpiPen. So this is within the case. So obviously this is a trainer,
Yeah.
alright? So it's not the real thing in the sense that there's no adrenaline inside it
Okay,
now.
okay.
But this is a life-saving
Okay.
treatment, and it's very handy, obviously, and it has it's very easy to use. Basically, you have the blue end and the orange end.
Okay.
The orange end is where the needle is inside.
Okay.
Okay, if it was a real one, it would be the needle will be inside this end. So as you see there, the first step is to take off the blue safety cap.
Okay.
So you take it off, right, and then you will then hold and grip the EpiPen in this manner.
Okay.
Alright, so you don't put your thumbs at any end. Hold it like that, and then it will go into the outer thigh.
Okay.
Right, so it will go here, right, because this is muscle.
Okay.
There's no blood vessels or nerve
Yeah.
like that. So you go through like that, you will hear a click, the needle has gone in.
Okay.
You hold it for 10 seconds.
10 seconds.
1,
Okay.
2, 3, 4, 5, 6, 7, 8, 9, 10.
10.
Take it out.
Okay.
Okay, so when you take it out, you will see now the protective jacket.
Okay.
Initially, it was like that. Now,
Yeah.
when it comes out, it looks like that. It's extended
Oh.
because the needle is here.
Yeah.
So, it's to make sure that we don't get any needle stick injury.
Okay.
For especially if for yourself, if you are doing it yourself, or
Or
for the
someone
others
else.
who are doing it. Yeah. So that's it. Very simple, but you must get yourself to the emergency still.
Yeah, right after using
Right
this.
after, so somebody will be calling for the ambulance, or somebody can get you to the emergency department as soon as possible. But at least you have got the treatment for it, and it's very much a life-saving medication. This is the treatment of choice for anaphylaxis, adrenaline,
And
or epinephrine as they call it in
yes.
some parts of the world.
And one last thing that that you guided me about the medic alert. So when I didn't know, I just made a bracelet like this. It is like it is having cephalosporins, penicillin censored written on it.
Yes.
This is like I just engraved it from a shop.
Yeah.
This was the only thing I could do because
Yeah.
I didn't know much how we can do something.
Yeah.
So the medic alert thing, it is. Can you tell what it is?
Yeah, this
how
Medic
it can
Alert,
help?
there's a Medic Alert Foundation, so it's a global international foundation, and here in Malaysia it's called Medic Alert Foundation Malaysia. So you become a member of the foundation. So through a prescription, and then so then you'll be on the database. They'll keep all the information. Then with that, they will give you either a pendant or something like the bracelet here. Then everything that's relevant to be engraved, even the sort of medications that you can or you are taking. If you have other diseases, then they will know what are the medications. But usually, like in your case, somebody's got anaphylaxis, then we'll write allergic to like cephalosporin. Yeah, because that's basically from this story, very convincing story as far as I'm concerned. So much so I didn't bother to do the oral challenge test to the cephalosporin. We went to straight the alternative. So because you have to avoid those medications now. So when you need antibiotics, we need to know which group. So then that's where we do the macrolides, then we do the quinolones, and then the sulfur-based antibiotics. So those are the others that we do with the challenge test.
And Alhamdulillah, with your help, I'm able to take 3 of those now, and 3 of those are permissible for me. And I'm really, really, really thankful to you. All my good wishes and prayers are for you, that you gave me so much of your time. You even came to the daycare again and again just to see if I'm okay or not. And I was just before coming to Malaysia, I was very much like afraid, you can say, that what is going to happen. But here I got such a friendly environment and such a friendly doctor that I am so much relaxed, and I am not even that much worried about Mina as well right now, because you have guided so well about her as well. So thank you so much, doctor. God bless you, and may Allah give you more success in everything you wish for.
Thank you very much, and I wish all the best to you as well and the whole family.
Thank you so much. Inshallah, we will meet again.
Inshallah.
Except for the medicine thing, we will meet again.
Yes.
With good health.
Yes.
Thank you so much.
Yes.